I'm joined by John, a 19-year-old who is coming to the GP with symptoms of a cough and a fever. I'll let you read the rest of the description, pause the video here and test what approach you'd do, and then see our model answer, and then we'll also discuss the mark scheme for this station. Hello there, my name is Rohan Yesudian. I'm one of the GPs. Could I just confirm that I'm speaking to John?
Yeah, I'm John.
Nice to meet you, John. I hear that you come in today with a cough and a fever.
Yeah, that's right.
How have you been feeling?
Pretty bad. So I've had a cough and a fever and like a headache. Haven't really felt like doing much, to be honest. Just been feeling really ill.
Okay. So, as we're in a pandemic, I need to ask you about COVID. So,
Yeah,
do you
sure.
think this infection might be COVID?
I've no idea, to be honest. Haven't tested or anything.
How about your COVID vaccines? Are you up to date with your COVID vaccines?
No, I haven't had any.
No doses at all?
No. None.
Is there any particular medical reason why that might be?
Yes, like the side effects. Like I've heard of vaccines having weird side effects and stuff like that. And I don't want to die of like a heart attack or get autism or something.
Okay, I understand your concerns. Is there anything in particular, anything else about COVID or the vaccines that you're worried about?
I just don't trust them, to be honest. Like, it's just new. Hasn't really been like tested on anyone like properly for a long time, so.
And just before we address the issue about like the vaccines, do you live with anyone at home?
I live with my mum and my dad.
Mm-hmm.
Yeah, it's pretty much it. Just us three.
And do any of your relatives have any medical conditions?
Oh yeah. My mum has cancer, so she's trying to shield.
Okay, she's shielding since the start of the pandemic?
Yeah, pretty much.
Okay. So, John, why I'm concerned is that currently you have an infection, and this could easily be passed on to the people you're living with at home. And particularly with COVID, it can be quite nasty for people who are receiving treatment for cancer, because that treatment can suppress the immune system, which can stop the body fighting the infection. So I just wanted to talk a bit about the vaccines and some of the concerns you had. So you did mention some of the side effects, like risk of like heart problems. And you are correct that there has been, in very few cases, maybe 1 in a million cases, that has been linked to a cardiac event, something with the heart. But these are exceedingly rare, and the benefits, the risks of getting a COVID infection and the complications, even for young and healthy people like yourself, can far outweigh the risks of like these rare cardiac events. I don't know what you think about that.
I mean, yeah. But like, how do you know that? Because it's quite a new vaccine. Like, how do you know there are not other stuff or anything else going on with it?
Absolutely. So the vaccines, although they were created at record speed, in about a year, we had like the first vaccine trials and countries were regulating them for use. But the thing to know about them, that they still have gone through the same rigorous testing that any vaccine has done. Everything was just accelerated because of the urgency of the global situation. So they're often doing multiple steps all at the same time, rather than waiting for one step and to start the other, because there's just so much demand to get the vaccines. And it has been, we do have independent regulating bodies who are independent from the government or like the NHS, who have looked at the vaccines, looked at the safety data, and are actually recommending it to use for all age groups now, including yourself. So based on this advice, I would advise you to take the vaccine if you're able to. I don't know if you have any other questions for me.
Is it alright if I just don't sort of pass and not take the vaccine?
So that is an option, as in no one can force you to get a jab in the arm, but we need to think about the potential benefits of the vaccine and the potential harm it can cause, not just to yourself but to others, so for vulnerable people in society, or maybe people in your close area of contact, such as people living at home. So I would recommend that you have a think about it. Maybe you don't need to just walk and get your vaccine right now. You can go home and have a think about it. What I would recommend is that you isolate from your mum, just because she is a bit more vulnerable to this infection.
Yeah, we both are shielding, so...
Okay, that's good to hear. And yeah, as you said, there's not necessarily a rush. We can discuss this over the phone, and you could always come back into the clinic on another day, when you're feeling better. I would also recommend, I know it's uncomfortable, that you do take the COVID test, just so we make sure that we exclude that as a potential thing, because it can be quite nasty for other people who maybe don't have as good immune system.
Yeah, fair enough.
Okay, so do you have anything else you want to share with me today?
Nothing else.
Okay, so we'll cut it there. Feedback from John, our actor. How do you think that went?
I think you did a good job of explaining everything. Trying to understand, trying to empathise with how I felt, and trying to understand what I thought. Understand or demonstrate that you have thought about my view.
Yeah.
Or John's view, and explained it in a logical manner so that John could perhaps change his mind.
Yeah. So that brings us nicely onto kind of the mark scheme. So I just kind of jotted down some points which you kind of want to do in these types of role play. Always introduce yourself just to make your role clear. And then we do this thing called ideas, concerns, and expectations. So this is called ICE. So throughout that, I was really trying to understand what John's point of view was and what his main concern. So he mentioned the side effects of the vaccine. And his idea was that COVID is not a serious infection, which may be true for someone of John's age, but for people with compromised immune systems, that might not be the case. Other things on the mark scheme is to address these concerns, and also have this shared decision-making type thing. So make sure that we're not forcing it on John, but he can go away and think about it, and we can come to a solution which works for both the GP and the patient. And yeah, red flags would be not actually trying to persuade John or recommend that he takes the vaccine or gets a COVID test. And another red flag might be forcing the vaccine on John. And just note, red flags means something, if you do it or you don't do it, you might fail that station. But yeah, thank you, John.
Feeling quite under the weather, yeah. Just a cough and a fever.
I see that you come in today with... Are you up to date?
Nah, I'm not really about vaccinations. Yeah.
This is way too hard. And how about your vaccinations?
No.
Are you up to...
No. Absolutely none of them.